Hi, you guys. Welcome back for our daily practice questions. It is day 287, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q-banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and houses all the resources that I offer. And I like to direct you to my business profile by simply going to Google and searching The Nursing Studio. It'll bring you here where you'll find my contact telephone number, link to my website, and testimonials from previous review students. Also, the final 5-week intensive review for the year starts October 20th through November 21st. If you're looking to join, make sure you click the link in the description. The $100 off sale ends tonight at 11:59 Eastern Standard Time. So if you're looking to join at that discounted rate, make sure you grab that before 11:59 p.m. tonight. All right, y'all. Question number 1. A 35-year-old woman presents with fatigue and shortness of breath on exertion. She reports heavy menstrual cycles. Her lab showed a hemoglobin of 9.2, MCV of 74, ferritin of 9, TIBC of 470. What is the best initial management? Is it A, start ferrous sulfate 325 milligrams orally 3 times daily? B, refer for bone marrow biopsy? C, begin erythropoietin injections? Or D, prescribe folic acid 1 milligram daily? Take a moment and tell me what you got. All right, y'all. Y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the best initial management? So, I always tell you, if we're looking for treatment, I always say run it back and look and see if they provided you with a diagnosis. If they have not, you have to run it back a step further to determine the diagnosis, because you got to know what it is to be able to treat it. So if they haven't given you the diagnosis, you need to run it back even further and look at those assessment findings, right? So here we don't have the diagnosis. So we need to look from the beginning, start from the top. Assessment, meaning signs and symptoms. How do they present? So there's a 35-year-old female. She comes in with fatigue and shortness of breath on exertion. She has heavy menstrual cycles, and her labs show a hemoglobin of 9.2. So we're starting to think anemia. Her MCV is low at 74. So remember, the microcytic anemias are your thalassemia and your iron deficiency anemia, right? The ferritin here is also low, where the TIBC is elevated. So this is classic for iron deficiency anemia. So now that you know the diagnosis is IDA, how do you treat iron deficiency anemia? So you need to think about ferrous sulfate. So your best answer is A, start ferrous sulfate, 325 milligrams orally 3 times daily. All right, question number 2. A 72-year-old man with a history of alcohol use disorder presents with fatigue and mild confusion. He reports a poor diet and occasional diarrhea. Labs reveal a hemoglobin of 9.8, an MCV of 112. The peripheral smear shows macrocytosis without neurological deficits. Vitamin B12 is normal. What is the most appropriate treatment? Is it A, oral iron supplementation, B, folic acid 1 milligram daily, C, vitamin B12 injections, or D, erythropoietin stimulating agent? Take a moment and tell me what you got, y'all. All right, I always recommend reading that stem, right? So stem here states, what is the most appropriate treatment? Again, treatment, we need to look to see if they gave us a diagnosis, and they haven't. So let's look at these assessment findings and determine what the diagnosis is. So we have a 72-year-old man. He has a history of alcohol use disorder. He has fatigue and mild confusion, poor diet, and occasional diarrhea. Hemoglobin's low. MCV is elevated, so we're thinking macrocytic. Just looking at the peripheral smear, if you're not familiar with that, the key here is that there's no neurologic deficits noted. Vitamin B12 is normal. So what is the most appropriate treatment for this? So, okay, think of the anemias. And again, if you struggle with anemias, go watch my 2-1-2 rule on my anemia video. But the two anemias that fall in that macrocytic normochromic range is your B12 deficiency anemia and your folate deficiency anemia, right? B12 deficiency anemia typically has those neurologic deficits associated with it. Also, the vitamin B12 levels will be low, right? They're normal here, and it shows no neural deficits. So the best answer here is folate deficiency anemia. So you want to give B, the folic acid, 1 milligram daily. All right, lastly, question number 3. A 60-year-old woman presents with fatigue, smooth sore tongue, and numbness in her fingers. She had gastric bypass surgery 5 years ago. Labs show a hemoglobin of 10, MCV of 112, peripheral smear, hypersegmented neutrophils. Which finding supports the most likely diagnosis? Is it A, low ferritin and high TIBC, B, a low vitamin B12 level, C, high retic count, or D, elevated ferritin level? Take a moment and tell me what you got, y'all. All right, still in the question. Which finding supports the most likely diagnosis? All right, so now this is clearly letting us know that we're trying to find our differential diagnosis, right? So we're going to work through those assessment findings and think of the differentials you may need. So we have a 60-year-old female, presents with fatigue, smooth sore tongue, and numbness in her fingers. She had gastric bypass 5 years ago, right? All right, so presentation. I'm already beginning to think of B12 deficiency anemia, right? Because with vitamin B12 deficiency anemia, beefy red tongue is common. Numbness and tingling is common. And also it's common to be associated with people who have had like the gastric bypass surgery because they're having poor absorption due to intrinsic factors, right? So let's just look at the labs and see if that helps with our differential. So the hemoglobin is 10, which is low, so anemia. MCV 112, which is elevated. Remember, macrocytic normochromic is associated with your B12 deficiency anemia and your folate deficiency anemia, right? So it's starting to confirm this diagnosis, but it's something that, it's a couple of things that we like to look at right here. So what would help you differentiate B12 versus folate deficiency anemia? Because that's where we're at, right? So let's look at our answer choices. So is it A, low ferritin and high total iron binding capacity? No, that is associated with iron deficiency anemia, right? Is it B, a low vitamin B12 level? Yes. That low vitamin B12 level would confirm our differential diagnosis of B12 deficiency anemia. So B is your best answer. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call. You can shoot us a text message or shoot us an email. And as always, everything that I offer is linked in the bio of this channel, including my website. And as I mentioned previously, my website is also linked in the description of this video. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.